Hi, everyone. This is Dan Toner. I'm the health insurance agent for Axis Motorcars. Hope everyone had a good Thanksgiving. Hope you have a good upcoming holiday. Merry Christmas to you and Happy New Year. The health plan for Axis Motorcars is up for renewal on January 1. Those of you that remember, we started it for the first time last year. Michelle and I got together and we decided, we look at the competition, we look at the other carriers, and we think Blue Cross is definitely the best carrier. So we're going to renew the plans, and we're also going to offer a voluntary dental and vision to everyone for January 1. So on the screen, I'm showing a copy of a memo that you'll be distributed, that will be distributed to you, sort of a summary for the whole year, welcoming you. Take a moment to look at it. You can enroll under the plan right now for open enrollment. We're going to ask that the deadline is Friday, the 18th of December, to let Michelle know if you want to enroll, if you're adding dependents, if you want to come off the plan, if you want to buy the dental or vision. Let's make that the date so we can get that information off to Horizon and they can begin processing. If you waive coverage, you'll be asked to either enroll or waive. If you waive, you can come back onto the plan unless you have a qualifying event, which is what you could see on the screen or the first page. Okay? So we're going to talk about the medical plan we're offering with Horizon and the new voluntary dental and visions. A couple things about Horizon, just a summary. I'm going to bring up the summary, and we have the current Omnia EPO Silver, and we are keeping that plan. So on the screen, I'm just going to go over a couple of differences and highlight the features of the plan. For one, EPO means you need to stay in network. You don't need referrals to see doctors like specialists, but you do need to stay in network. You have coverage out of network if you have an emergency. The way that the Omnia program works is it has two levels of coverage. So on the screen, you can see I'm pointing to the primary care doctor copay. When you see a primary care physician and you use what's called a tier 1 provider, you will pay a $35 copay. The deductible is waived. So there's a little note at the bottom, DW is deductible waived. You don't owe the $1,250 deductible that's listed at the top, and I'm going to go over that deductible in a second. If you see a tier 2 physician, you have a $2,500 deductible and then owe 50%. On the Horizon website, and later on in the memo, I'll show you how to look up doctors. Horizon tells you if their doctors are tier 1 and tier 2. So this is definitely an incentive-based plan that wants to make sure that you know that you're maximizing your coverage by seeing tier 1 doctors and hospitals. When you go to tier 1 lab, you pay $0. LabCorp is one of their participating tier 1s. You pay $0. X-rays at a tier 1 is $0 that you'll pay, 100% coverage. At the pharmacy at the bottom, you have a $20 copay. There is a separate $250 deductible and 50% coverage for name brand. That's the current plan. If we look at the renewal, you'll notice that they lowered the primary care to $30. The specialist is $60. They lowered the liability for name brand. Instead of paying a $250 deductible and 50% to unlimited, they gave you a richer coverage by guaranteeing that that 50% you pay will never be more than $250. So that's a good thing. They increased the hospital and surgery deductible. So let me go over that now. If you have major big claims like hospital, surgery, MRI, which we call imaging, CAT scan, PET scan, MRIs, you have to meet your $1,300. If you go tier 1, you meet your $1,300 deductible. And then you owe, for example, a $250 copay for surgery, or a $100 copay to the emergency room, or a $100 copay for imaging, or $500 per day or per night at the hospital. But after the 5th night, you don't owe any more of that $500. So you pay the copays after you meet the deductible. If you go tier 2, you owe 50% after $2,500. So certainly there's an incentive for hospital, doctor, everything to use tier 1. If you are a single, you will have the first number as a calendar year worst case scenario. The $8,550 is simply meaning that your bills, your copays, things that you owe, will never be more than $85.50. Clearly, the plan is rich enough that most people won't hit that number, but that's what that means. And if you have families, your copays and deductibles will never be more than $17,000. Okay, so that's a description of the plan. Your deductions are going to be taken out of your paycheck on a pre-tax basis. Michelle will be handing you the cost sheet for each of you. There's $150 a month or $1,800 a year contribution from Axis to participate in the plan. On screen, I'm showing you the HorizonBlue.com website on how to look up your doctors. So take a moment in there and make sure you're finding tier ones. By the way, little tip. Notice if you go urgent care, it's a $75 copay, the deductible is waived. But if you go to the emergency room, you have to satisfy your deductible and then pay $100. So try when you can to see an urgent care as opposed to going to the emergency room. And look up those. In other words, look up your doctors, hospitals, urgent care centers. Try to find your tier one as best you can. New this year for January of 2021, we're offering a voluntary, paid by the employees, a dental and vision plan. The way the dental will work is we're going to go with Horizon. We're using the PPO network. On that same Horizon website, there's a button that says, how do I look up dentists? And the network is called the PPO. Good part about dental is you'll have coverage both in and out of network. So that's a nice feature. And the way dental works is they break it down into services. Diagnostic and preventative are things like checkups, cleanings, exams. Horizon pays 100%, you owe $0. 80% are things like fillings and surgery. And major services like crowns, bridges, root canals is 50-50. Everyone that's participating gets a $1,500 benefit. So a lot of folks will ask me, at $8 a week for a single, is that worth getting $1,500 worth of benefit? So when they pay 100% for an office visit, and let's say your office visit is $100 or $150, and you do that twice a year and it's $300 worth of office visits you're getting for free, then you got $1,200 left in your benefit. So they're paying out claims with a $1,500 cap. That's what that means. I clearly think it's worth it because if you're giving them, say, a couple $100 a year to get $1,500, I think that's worth it. You can cover your spouse, children, and family. There's 4 ways to get covered. It does not have to match your medical. On the vision, same thing, voluntary plan. You could see the premiums at the bottom for singles and couples and families and your deductions per week. Vision is a combined copay and a cash reimbursement. Great benefit for those that are wearing glasses. It's based on frequencies. Every year you can have an eye exam. Every year you can get lenses. Every 2 years you can get frames. And every year you can get contacts. Keep in mind that if you have a medical condition like glaucoma, for example, that's covered under the medical plan. If you don't have a medical condition and you want your eyes checked, that's when you need a vision plan. Horizon's medical will not cover routine eye. That's why you need a vision plan. Again, it's based on frequency. So every year when you go for your eye exam, you will pay $10. That's probably worth the benefit alone. And then the balance of that visit is paid at 100%. What Horizon does, you can go to HorizonBlue.com, click the Vision tab for when you find a doctor, and it'll take you to Davis Vision. They outsource the network to Davis Vision. And when you're going in network, you have an out-of-network benefit that tells you you're reimbursed a smaller number. So what you want to try to do is stay in network. You'll pay a copay. For lenses, you pay a copay. And for frames and contacts, you get a reimbursement, a cash reimbursement of $130 plus 20%. So it's sort of a combined copay to the doctors and copay for lens and a cash and discount program for the hardware. So I hope that makes sense. My last page of the memo is, by the way, they have a teledoc service to avoid going to the doctor. You can use the teledoc service. They'll call in prescriptions for you. Great feature. Make sure you use it. So there's the Blue Cross customer service information. And my company, FFP, Debbie is my account manager here at FFP. I'm your broker. Sandra's here to help people on enrolling and disenrolling under coverage. So that's a little bit about us. Again, Dan Toner, and I appreciate you guys and all your time, and have a wonderful holiday. And make sure you tell Michelle what you want by December 18th. Have a great day.